Thank you for joining us here for the second in our series on COVID-19 webinars at NICWA. As I said earlier, my name is Jeremy Chase Israel. I'm the Member Relations Manager here at NICWA, and I'm joined today by David Simmons, the Government Affairs and Advocacy Director at NICWA. If you have joined us before, as I just said, this is the second in the series on the COVID-19 human service funding. So you're going to learn about how to identify resources. You're going to learn more about just COVID-19 as a whole. And I see a question here. Yes, you'll be able to access this webinar. We will be sending out recordings to people who attended and were not able to attend, as well as making PowerPoint available as well, which I had a question about. So the way that we're going to try to stagger this is that I encourage people to use the Q&A function. If you have questions that you want the panelists to read, I myself will be moderating the chat. So if you put stuff into chat or you're having issues regarding sound or video, I'll do my best to respond to you. And other than that, I'm going to pass it off to David. So thanks again for joining us today.
All right, thank you, Jeremy, and good afternoon, good morning to all of you out there. I'm hoping that your week is starting well and that you and your families are safe, most importantly, of course. So today this is the second in our series of webinars focusing on human services and COVID-19. Our first webinar we did back in March 19th, and we talked a little bit about some of the kind of things that we were just starting to learn, some of the concerns or challenges that we knew that some tribal human services programs might be facing, some of the resources that we knew were out there in different places and that were coming together. Now we're about a month later, we've learned quite a bit more about even some of the impacts in human services for tribal nations. The other thing that we also know much more about now is we have more information about the more recent funding that's come through what's called the CARES Act. That's phase 3, as it's also referred to, of COVID-19 funding for tribes and states and businesses. And we also have, and this is important, because even though Congress appropriates funds, gives flexibility, it's up to the agencies, the federal agencies, to then interpret some more of that and get guidance out to us. And we're just starting to see more of the guidance. Actually, last week we started to experience more of that, and so we'll be able to share a little bit of that with you too. So I'm going to just start by talking a little bit, giving you a little bit of background. And this background is really about what NICWA's sort of position is, or what our approach to this work is. We know that we are not the experts. No one is really an expert on COVID-19 in terms of how to respond, especially in human service dynamics in tribal communities. So we need all of our good thinking. We need to be a community of learning, and we need to be thought partners in this work. And so we're going to be, during our work, we're going to be, as we already are, but we're going to be doing more of this, reaching out to you and asking for your help to help us identify what the challenges are, and even some of the creative thinking that's out there and what people are doing to develop solutions. So we're focused on your program issues, your staff, some of your clients, and the caregivers that work within your programs or with your programs as too. We're also going to be engaged in working with tribes and national Indian organizations, as we already are, non-native child advocacy groups like Child Welfare League of America and Children's Defense Fund, and members of Congress and the administration too. So our advocacy works from this. So we want to be able to provide information, share information in a timely way, accurate information for you. But we also know that we're going to have to be working on the advocacy side of this, trying to make sure that we raise awareness within Congress, within federal agencies, about the best ways to help meet your needs as you've described them. So we definitely will be sharing more of that, and we'll be doing it over a variety of platforms. So we'll talk more about that later. So far, Congress has to date passed 3 COVID-19 bills, and you can see the 3 bills here. It started with the earliest bill, HR 6074, which was passed in early March, and then more recently, March 27th, was HR 748. So additional bills are being developed and discussed We don't know the exact timelines. Actually, this week, they're working on what they're calling phase, not 3 or not phase 4, but phase sort of 3.5, we'll call it. And this is a bill that's going to respond to small business loans, more small business loan money. It's also going to respond to funds for hospitals and staff and equipment. And it's also going to respond to stabilization for governments as well. We don't have the details of all of this yet, but there's expected to be an agreement between the Congress, the Senate, the House, and also the administration here coming up sometime, hopefully by the end of the week. So in part of our advocacy, we've already been involved in developing a number of requests for and in partnership with Indian organizations, tribes, and other advocacy groups. So we're working both on a native and a non-native fronts. And we can share a little bit more about that as well. And monitoring and advocating for timely and fair dissemination of funds. This is always the question. Once we get the resources, how do we make sure that they're going to get out to you in a timely way, first of all, and in a way that is fair and works for yours? So, one of the things that you should know about our advocacy is that there are lots of things, lots of levers we could pull, right, to get more resources to tribes. But one of the things that we believe is that it makes most sense and it's most certainty when we provide funds that tribes in large numbers already have access to, funds that are flexible and provide lots of opportunity to work on a variety of issues depending on what's needed, and also funds that can reach and the money can go out rather quickly, so you don't have to fill out new applications and things like that as well. So those are kind of some of the principles that we're working from as we do our advocacy work. So here on this slide, you can see what some of the requests are. And we have all of these requests are things that have been made. They haven't specifically been part of any of the current bills that are already out there. These are specific to programs themselves. I'm going to talk to you a little bit more about some of the more general things and the other funding that has been appropriated through earlier bills. But these are requests that have gone out primarily for phase 4, I would guess, are going to be tucked into those hopefully. So we're working to make sure Congress knows that there are specific needs for tribes in human services in a variety of areas, not just BIA and not even just HHS in some regards. But here's an example. So we've got here $20 million for NICWA grants. Well, $20 million represents about the average annual amount that is appropriated by Congress for NICWA each year. So we're essentially saying we need an extra year's worth of funding here to make sure that tribes can respond to the needs and child welfare, things like when you're having placement disruptions, if people are getting sick, families who need additional support and help with basic needs, things like that. The second one relates to that too. That's the BIA welfare assistance grants. Lots of tribes operate these grants, not all, but lots of tribes do. And $75 million represents about a full year's worth of funding under BIA welfare assistance grants. And you can see in parentheses there that BIA welfare assistance actually is comprised of a number of programs like emergency assistance, child assistance, general assistance, adult care assistance, burial assistance, and social services. Lots of human services pieces in there. And one other thing that is actually in part of the request, which isn't about funding, is that BIA's welfare assistance program, the one called emergency assistance, that it would be defined as more than just sort of like natural disasters or emergencies, but that it would also include like COVID-19 pandemic kinds of issues to give greater allowance for tribes to spend those funds as they need. Number 3 is now we're moving into HHS programs. Title 4B Subpart 1, also known as the Stephanie Tubb Jones Child Welfare Services Program. This is a program that has about $5 million annually. It's very small for tribes, but there's over 300 tribes that get these funds each and every year. So by providing a $30 million increase, it would give much better size grants. And I think because this is a very flexible funding program, one of the most in our HHS, we think it would be very helpful, like NICWA funds, for tribes to be able to move it around and use it in ways that would help support kind of child welfare and COVID-19 issues. The second one is the companion to the first Title IV-B Subpart 1 program. It's called Title IV-B Subpart 2, promoting safe and stable families, as some people might know it by that name. It has about 100, it has a little over almost 200 tribes who are grantees to this program. It has a little bit more money than Title IV-B Subpart 1 does for tribes, but it also has other components to it as well. So it's got a $20 million, it's got a mandatory program, it's got a discretionary program, very similar functions and purposes. And then there's also a tribal court improvement component to Title IV-B. They're all tucked in together. So we're asking for $45 million here and asking for those funds to be spread out, $20 million for mandatory, $20 million for discretionary, and then $5 million for tribal court improvement. Now, right now, tribes receive under Title IV-B Subpart 2 about $5.5 million covering everything but the tribal court improvement, where they're receiving about $1 million a year. So you can see this would really step up the amount of funding available. And it's important that we include tribal courts, of course, because we know that this is during child welfare and COVID-19, we're seeing delays and concerns about how to do court proceedings, because we want to keep them moving if possible, but how to do them in ways that we can make sure that people can participate virtually. So the court and the agencies all have needs here. The number 5 is Title IV-E CHAFE funding for tribes, increasing that by $20 million. Now the CHAFE program is part of Title IV-E Foster Care and Adoption Assistance Program, but it focuses on youth, usually around the age of 16 all the way up to like 23, who are aging out of the foster care system or who have aged out. Now we're starting to hear a little bit about some of these youth, some who are trying to pursue college or university to get degrees so they can get better employment later. Others who are actually leaving, hitting that age 18, looking to get their GEDs completed, or just getting into job training programs, trying to do employment. We know this is a particularly vulnerable group. So by definition, they don't necessarily have permanent homes to go to. They may not have a family home to go to because they've been in foster care most of their lives. In these situations, we want to make sure that we aren't leaving these folks behind, because some of them might have been at universities or colleges where they shut down the dorms. Most colleges are shut down now, and they have to find ways to get somewhere. They have to find places to be able to house. They need housing. They need other kinds of help and things like that. So right now we think that the amount of 4E CHAFE money that goes to tribes annually is probably less than $5 million. So this is a big increase here, but it is certainly this is also for a population that has pretty big needs beyond just kind of general child welfare services. And the last item here on the list, number 6, is the Title 20 Social Services Block Grant Program. This is a program that's been in place since 1981, but only states are funded through this program. It provides almost $2 billion every year to states who are able to use the funds for adult protection, people with disabilities, funds for helping with child protection services. It really was created out of several smaller kind of grant programs that were operating within the federal government at the time. And so during the Reagan administration, they created the Social Services Block Grant, and it's very flexible, and it's really designed to help fill the gap where other programs, federal programs and such, aren't able to do that. So in a situation like the pandemic where we're in right now, this is the kind of money that states really depend on to be able to fill those gaps. We're asking, it's long overdue, but we're asking for Congress to create a 5% set aside for tribes. This could generate over 60, 70, possibly as much as $100 million, depending on what the SSBG funding overall is. but this is consistent with the way that we've approached and the way that Congress has been approaching many programs that have been created since the 90s. And so we're hopeful that maybe that can be something that gets done this year. So here is brief descriptions of what phase 1 and 2 bills were, the two earliest bills. They were focused, they were much smaller, and they were much more focused on the health side of this, especially the first bill, which was about $8.3 billion. $40 million was reserved for tribes. And you can see that it really is focused on like testing and vaccine development and basic health kind of staffing and supplies issues. This money is, most of this money has already been spent and has already been allocated, it's obligated. So now moving to the next bill, 6021, this was a little bigger at $800 billion. There were $74 million for tribes, most of it going through the Indian Health Services, but 64 million, which was that part, but 10 million also going to Older Americans Act for Nutrition and Services in tribal communities. This bill, though, also looked at things like extending paid sick leave, making coronavirus testing free, expanding food assistance, additional unemployment benefits, and requirements for employers to provide additional protection for healthcare workers. So again, these funds, most of these funds have already gone out the door as well. So now we're at the place where we're looking at the CARES Act. This is the most significant bill by far. It had $2 trillion approximately of funding in it, and about 10 billion of that was reserved for tribes. So the bill itself was looking at things like the program to provide individual payments to taxpayers. So you know about these sort of stimulus checks, as they've been called sometimes, that are going out from the IRS. That was a big part of it. Expansion of unemployment benefits to extend the time for benefits, but also the amount of benefits that could be provided too. Student loan forbearance, not having to pay student loans necessarily during this time while COVID-19 has affected most of the employment for many students who are out of school. And food for food banks too, additional resources for food banks. And loans and grants to small and large businesses. This is a very big part of it, 150 billion of it, at least, for grants to 350 billion, excuse me, for grants to small and large businesses. And then funding for hospitals, health providers, and then funding to stabilize state, tribal, and local governments as well. So the tribal human service provisions under the CARES Act included $8 billion through the Coronavirus Relief Fund for tribes. So the funds are pretty flexible, but they can be spent on any activities necessary that were incurred due to COVID-19 issues and were not accounted for in a tribe's most current budget. Well, what does that mean? In other words, you didn't have in your budget prior to the passage of this bill, which was March 27th, some kinds of activities related to COVID-19. In other words, you'd already budgeted for it. Well, that's almost no tribes had those things in their budgets. So this really opens the door for you being able to use these funds more flexibly. And it also sets some parameters on when the funding can begin, which is March 1st, and then when it would end, and which is on December 30th. Now, this may change the end date. Maybe Congress will decide that they need to extend and even provide more funds. But right now, this is what we're looking at. And this, so out of the 10 billion that tribes received through the CARES Act, 8 billion of it went to the Coronavirus Relief Fund. So one of the things that it's important to know about these funds is that they will be coming to tribal governments, and the funds may not be in your community quite yet. I know tribes are working with Treasury Department, for instance, to try and get these funds out the door as quickly as possible. But part of what will be important, of course, is communicating with tribal leaders about how they can use their share of those funds and how human services is one of those areas. Another piece of this is BIA, Operation of Indian Programs, $453 million. That is approximately about around 20% of the budget for almost all Operation of Indian Programs under the BIA. But so these are funds that went out to also help for COVID-19 preparedness, prevention, responses. But it's broken down, that 453 million, this way. First of all, there's 380 million that's distributed directly to tribes through a BIA budget line item called Aid to Tribal Governments. So why did they choose this? Well, we don't know exactly, but this supports BIA providing funds for tribal governmental services and technical assistance and things. I think they chose, rather than taking the 380 million and trying to distribute it through any number of different budget line items, including human service ones, they said, we're going to put it all through this, we're going to make it a little easier, and then tribal governments individually will decide how to distribute those funds amongst in their tribal budgets. And this includes both tribes who are contracted, or we call 638 tribes, they've contracted BIA services, or their self-governance tribes, tribes who are operating through the self-governance offices in that process. And it also includes, and there are not as many of these tribes now, but tribes who are actually still having the BIA do services for them. So there are ways for all tribes to receive these funds at the nearest point of time. So there's also 20 million that's specifically reserved for BIA welfare assistance programs. So I mentioned those programs earlier. And then another 20 million reserved for the BIA is holding back for what they're calling unexpected surges. They might be in welfare assistance program areas, or it could be elsewhere, but they're holding on to those funds at least into the beginning of May. They also have a remaining 33 million after all of those other funds are reserved that the BIA is going to be used for operations related to their programs, agency, and staff. And they've talked about and given examples of things like facility cleaning, quarantine of inmates in their facilities, and then overtime costs and technology investments. So they'll be retaining that out of the 453 million of that for their own operations. The direct funding and how it's going to be distributed to tribes is going to be distributed in proportions related to enrollment numbers of each individual tribe, with not less than 60,000 per tribe being distributed. The welfare assistance program funds will be about $20 million that will be also distributed based on enrollment. They aren't giving a floor for how much every tribe will be guaranteed, but they are going to be using. So what they do is they essentially say, look at the enrollment of this particular tribe and then compare it to what percentage of that is that of all enrollments for all tribes. So they're going to be doing sort of a per capita distribution, it looks like, for the most part. And we just learned about this information actually last week when the BIA released a letter to tribal leaders and then had a phone call to discuss this. And tribes are asked to contact their BIA regional or self-governance office to make arrangements to receive these funds. So this means that your leaders, maybe your CEO, are probably going to be negotiating with BIA offices to figure out how much of this is our share and how are we going to, at least where are the areas we think we're going to distribute the funds within our governmental services. This will be, again, another opportunity for tribes, for tribal human service directors to be able to get in communication, share what some of the concerns they have, what are some of the issues or needs they have, and also to be making sure that some of these funds also reach beside just those under welfare assistance, but some of the other funds possibly too. Now we move into some other places in the CARES Act outside of BIA services and then kind of the stabilization funds earlier I spoke about. So there's some individual programs, a lot of them are HHS related, where the CARES Act provided funding and tribes are receiving a share of that. So the first one is Family Violence and Prevention Services Act. There's $45 million in the CARE Act for that. Tribes receive a 10% set aside from this program. And so there'll be about 4.5 million for domestic violence shelters. Now we know we're seeing some increases and concerns about numbers of domestic violence events in communities, both native and non-native. And so hopefully these funds can help support additional safety and prevention resources there. Title 4B, Subpart 1, Child Welfare Services, the program I mentioned earlier is one of our focuses for an ask, received $45 million. Now, the tribal portion of this is in the it is part of the statute. It's shaped by how the statute talks about this. But really all it does is it says that the secretary can decide to share these funds. Well, they've been doing this for many, many years and decades. But it's hard to come up with an exact estimation of how much funding this would be for tribes. We think using some of our own math and looking at historic numbers, it will approximately be around $850,000 additional funds. And remember, the annual tribal allocation for all tribes every year is around 5 million. So it's approximately almost about a 20% increase. And I would imagine that in terms of the way the Children's Bureau has been talking about how they're allocating these additional funds through programs like Title 4B, that there's two things you can do. One is speak with your regional administration and children and families office to see where that's at. And the other thing that you can do is also to talk with your your budget folks, the people who are receiving those funds, when the drawdowns come, some of your fiscal staff, to see if they've received any of these kinds of funds yet. There's also money for community development block grants and Indian housing block grant, $100 million for the first and the $200 million for the second. This is to help with housing assistance, rehab, and sometimes new construction, economic development, and infrastructure development. We know a lot of families don't have adequate housing in human services and in child welfare. And so this might be an opportunity for these additional resources to help support housing, better housing, affordable housing for these families as well. Child care and developmental block grant. There's been a lot of discussion about this throughout the last month. In the CARES package, they provide $3.5 billion of additional child care funding for states and tribes. Tribes receive at least a 2% set aside, and it can possibly be raised by HHS. But at a 2% set aside, we would expect around almost $90 million additional child care and developmental block grant funds. And I looked up the numbers, and 87.5 is a little bit less than the annual allocation that goes out to tribes, but it's pretty close. So this is like getting an additional year's funding. And we know, of course, that there are lots of, in communities, there are lots of child care home providers in Indian communities, as well as there are also some tribal centers. Many of those may be shut down possibly, but I have heard about some tribes using their Head Start program, for instance, as a child care center for kind of frontline workers, just to make sure people don't have to worry about those situations. There's also additional funding for Head Start programs, about $750 million. We don't know exactly how much the tribal allocation of that will be, but we know there's about 155 tribal Head Start programs around the country. So we'll learn more about this, but it's good to know that these funds are coming soon, hopefully. And there's also money in Community Behavioral Health Clinic Expansion Grant Program. There's about $250 million, with $50 million reserved for suicide prevention. Of that $250 million, $15 million is reserved, at least $15 million is reserved for tribal programs. So in terms of behavioral health services and things, trying to find out, does your tribe have one of these kind of grant programs? Do they have a Head Start program, childcare? If you have the ability to figure this out and see whether this kind of funding is in your community, it can help you to learn about ways to maybe partner with other agencies within your community. HRSA, as it's called, the Health Resources and Services Administration, has additional funds for telehealth and rural health activities. They've reserved at least $15 million for tribal telehealth and rural health activities. So the question is, how do we get these funds? Well, think what you can do to start the ball rolling would be to contact your regional HR or HRSA office. In each, there are 10 regional offices around the country. If you go on to the internet and Google HRSA, essentially Health Resource Services Administration, and put regional offices, it should tell you where this is and how you might be eligible to get some of these funds. And maybe your tribe is already applying for it through your behavioral health or some other place. But HRSA is the agency that deals often with things like Medicaid and Medicare programs too. So likely your health clinic knows it has interactions with them and may know something about this too. And last, we've got Public Health Service and Social Services Emergency Fund. Again, $15 million reserved at least for tribal health and related social services. So when I think about child welfare, I think about many of our families. That includes the care providers, the birth parents, and the children have health needs, ongoing health needs. And whether it's related to our case management to try and make sure that they're getting those services, or it's related to actually doing kind of work agency to agency, partnership development and things like that. There are needs related in health, obviously, for child welfare families too. So this might be another place where maybe you'll see that your health clinic is working on this, trying to get some of these funds, letting them know what are some of the health needs of your population in different areas and how can we coordinate together on these things. One of the things we've been hearing in at least a few communities is that families are uncertain about when they should go get health services, who to go get health services from, and especially with COVID-19 and just fears about contracting COVID-19 if they go get services. So some families are not really taking care of themselves in terms of their health needs and may need a little extra support, and maybe these kinds of funds could be helpful. Low-income home energy assistance program. Certainly this is a program that's been around for quite a while, and there's about 150 tribal programs. We don't know the exact amount for tribal allocations, but we know that almost $1 billion of additional money for this. And this program is a program that actually helps kind of pay the bills, pay for your heating, and your AC, or if you have that, things like that, any kind of these kind of energy issues. And so it's helping support, especially in these times when people don't have the same kind of resources that they might have had previously, help them make sure that they can get out from under kind of those home energy costs. Food distribution, big area. I'm hearing everywhere with everyone I've had conversations, they've said, on child welfare, we've had to really think even more about sort of basic needs, and food, making sure that there's food for all our families is one of those. There is $100 million for tribes through the food distribution program on Indian reservations. The $50 million of that is for facility improvements and equipment upgrades. Another $50 million of that is for additional food purchases. And there are several billion more, several billion more that have been dedicated in other federal nutrition programs like child nutrition programs that are federally funded, and then SNAP too, of course, the former food stamps program. So there are some resources out there. The question is, how does your tribe operate some of these programs? If not, are there others, maybe state or county agencies, that might be able to help you with some of these kinds of things too? Now this slide has a program that is not COVID-19 specific, but it is I think is important to the whole scheme of programs and services for child welfare. And during the passage of the FY 2020 budget by Congress, the appropriations, which happened back in February, what we saw is that Congress included some what we're calling Family First Transition Act funding for tribes and states. Now the funding can be used for a variety of purposes, but it's about $15 million for tribal grantees. So when you think about it, that's knowing that there's usually only about $5 million that goes out annually. this is 3 times more than what your normal appropriation would be. So the funding can be used for any of the Family First Prevention Services Act transition activities, and that's the law that is now focused on including under Title 4E the ability to have more prevention services, reimbursable things that help care providers and children who are at home at risk of being removed, things like that, coming home from reunification. But it also includes, and this is probably the bigger category for most tribes, is any activities that are allowed under Title 4B. And as I said earlier, 4B is one of the most flexible federal child welfare programs out there. It includes services on almost every area. So this is funding that you don't have to do anything for if you're a 4B grantee. And the funds that I've heard from a couple tribes are just starting to flow to the tribes. But you might check again with your comptroller, your fiscal people, or your administration for children and families office, regional office in your area, and they can tell you a little bit more about when those funds are likely to come and how much you'll probably be eligible for. So some additional funds that are coming at a very important time that could also be used probably for COVID-19 purposes. So what are some of the strategies here with this funding? So communication is key. I've mentioned a couple times earlier that we need to make sure that we're sharing our challenges and our programs, what our resources are currently, and how do they match or don't match up with the needs. Making sure our tribal leadership know about these things so that we don't get left behind. And also sharing with groups like our state leaders, our child welfare people, and other partner agencies. They might be partner agencies within the tribe, they might be outside of the tribe, but sort of taking an inventory of what people know and what kind of opportunities they might be seeing too. So one of the things we know that's happening during this whole pandemic is there's a lot of information flowing around all the time, and it's being updated all the time as well, almost on a daily basis, sometimes more often. So communication during these kind of situations is really critical so that we can make sure that, one, people understand what our needs are and how they might fit with other agencies and what their priorities are, and making sure too that there aren't adverse situations for the families and children in our communities too. And third, I would say, is looking for new opportunities and making sure that people understand if you have some additional resources, we could use some of those resources for different things. And I know some states have been reaching out to their tribes and sharing funds in counties as well. So just thinking about that and what opportunities might be out there through communication. Also thinking about how have the needs of children and families changed during this time? We know that there's a lot of kids and families who would normally be in school, or kids would be in school. We know that there are families who would be going to regular healthcare appointments and things, places where others might be seeing them and then could be identifying if they're a risk for child abuse and neglect, for instance. Because these things aren't happening the way that they used to, our families are becoming more isolated as they're sheltering at home. And as they're becoming more isolated, they have a lot of questions about, how do I get help that I used to depend on, things that I used to do regularly that are important? Where do I have new needs that I didn't have before? And how do I deal with with the additional isolation, which can create anxiety, depression, and uncertainty for sure in many of the families on a day-to-day basis. And not being afraid to ask funders for flexibility to meet the needs as they've changed. Even here at NICWA, we've done this already ourselves. We went to some funders and said, we had a nice plan to do this project, but now with COVID-19, a lot of things have changed for us. And we've actually been really very glad that a number of our funders have actually been very flexible with us and said, we understand what's going on is completely unforeseen and unexpected, and what can we do to help? So I would just encourage you to think about that as it doesn't hurt to ask for additional flexibility. And then partnering too on funding too. Are there opportunities to share resources and support basic needs? And I put that in there specifically because as I'm hearing more and more about child welfare programs getting into the business of helping deliver food, helping with housing concerns and things like that, I realize that, that the face of tribal child welfare is changing fairly significantly. And so we need different kinds of relationships in those times too. And so are there other funders that people have relationships with? Maybe it's a private foundation or something in your area. But just thinking about how you can develop additional relationships and maybe opportunities, because the pandemic, even if everything, let's say by the end of summer, that COVID-19 became a non-issue, at least in terms of new cases, we're still going to have the residuals of it, the impacts of it for a while, as we're trying to recover from all of the change, and it won't be immediate, of course. I would also encourage you to visit especially your federal funders' websites, but other funders as well too, if you have those funds. Almost all of the websites that I've been going to have some kind of COVID-19 pages or information, and it's really helped. Some of it is kind of general, but there's a lot of information that can be really useful to you and helping you understand how you can use funding, where there's new funds available, what are the timelines, the process for accessing any funds that are out there. And the example I gave here is from the Children's Bureau. In fact, this letter isn't even on their website, at least it wasn't as of yesterday. But they sent out a letter that said, here, you know what? We've gotten a lot of questions about how can you spend Title IV-B funding for technology purchases related to COVID-19. And so we actually uploaded this onto some of our website stuff, and and sent out an email, kind of a constant contact email. But it basically, the Children's Bureau gives really nice guidance to say that you can use your 4B funds to purchase devices and to help people with, trying to get Wi-Fi and things like that, if it's related to child welfare purposes under 4B, good case management and things like that. But I would encourage you to kind of don't assume, check on what's there. And if you don't see what you're looking for, then to ask questions about it. Here, I've just got a list of a number of the different funder websites. There's the Children's Bureau, all things child welfare, and under HHS. Here's a TANF. They have a page too on COVID-19 resources as well. SAMHSA, behavioral health issues. They have one. Good. They have a lot of materials there. BIA has one, of course, and then Administration for Native Americans has some. They do mostly grant making at ANA, but they do have some materials there, and I'm going to be following them to see what kinds of things that they promote here in the coming weeks. Now, I've also included a page here with tribal websites and resources, so you can see a number of the national organizations, including ours. And including here at the bottom, now I have included American Indian Court Judges Association. They are just getting some of their resources together, although I was on a webinar last week where they were talking about juvenile courts, tribal juvenile courts, and COVID-19. And so they're starting to kind of build their information and resources too. And even though you may not be working in areas of like education and things, I find it's interesting because some of the information, like I think about education, I think about our case plans and how the education is such a big part of services, for many of the children and the families that we're working with in the systems. And so knowing what's going on in education informs us about what our families having to deal with at home sometimes, and how challenging that may be or may not be, or supportive. This page, I just wanted to say a little bit about what we're going to be doing in going forward. So our strategy is, developing as well as we move forward. So we're going to continue we want to engage you, and we're even thinking about other ways to do this. Maybe have town hall kind of meetings or things to learn more about what you're doing. Right now, we're doing phone calls and having conversations in groups. Group calls to some extent, but there's so much more to learn, and I'm just always constantly appreciative of how hard people are working right now in the tribal human services side, how creative they're being, and there's a lot there to share with other tribal communities, and I think even beyond, that could be useful too. So we want to continue to engage with you, and you'll be learning more about that. But you can always, if you want to, send an email to us, post something on our Facebook or our Twitter account, things like that, to just call our office and send into email like our info@NICWA. Tell us what's going on and we just are starting to get a little bit, just a very little bit trickling in from people who are asking us questions about COVID-19 or actually providing information about resources. So we're really appreciative of all your efforts there. We're going to continue to research and add new resources to our website. We're going to send alerts to you through our social media, our Facebook and Twitter, as well as membership email alerts too. And we want to do at least one webinar each month. And our next one in May, I was trying to get this done hopefully sooner than later. We'd like to actually we're going to try and reach out and invite some of your peers to be on a call and to do some presenting about what they're doing in their communities to address some of these COVID-19 issues. And we know that there's lots, like I said, lots of creative thinking out there, and people are doing lots of really interesting things. I have a couple of, one of the ways we can engage is I have a couple of different, and you can do this with Zoom, a couple surveys that I want to put out here. So I want to ask Jeremy to put our first survey up and send it out to people, and just ask you to answer this first question, and then you'll get to see the results here shortly afterwards. You can just take your mouse and click on either yes or no, and then it will tabulate them, your responses. Okay, now Jeremy's going to post this here in a little bit. Yes, so about 2/3 of you are saying you are experiencing some shortages of funding due to COVID-19 issues. So, okay, all right. Jeremy, can you put up our second question, please? Here, it's a multiple choice question, but you can check on more than one box, so feel free to do that. But if you can keep it to just your top two, that'd be great. Okay. Okay. So this is very interesting. So 73% said not being able to check on children in person is definitely one of the concerns they have. A much lower number were concerned about checking in, finding challenges with checking in with caregivers. But the in-home services also very high at 64% too, and also people talking about court hearings not happening. One of the things that we're hearing about, at least state court hearings, I'm not sure about tribal, is that most states are not proceeding with anything other than like the shelter care or emergency proceedings, and they're postponing or not conducting any termination of parental rights proceedings, things that are like that. Now that can be could be positive for some. The question, of course, the question is, how does that relate to you know, what our families getting services during this time, or is that not happening possibly? So this is very interesting. Thank you so much, Jeremy, for that. I'm going to go back to the slides. This is part of our strategy too. We're also going to continue advocacy with Congress and the administration every day, every week. And we're going to be continuing our partnering with non-native organizations too. I will share with you that we've had really nice outreach from a number of our non-native partner organizations out there who have been doing the things that we really like to see, which is, one is asking us what are some of the needs. But in some cases, like with the Title 20 work, you know, we have been working, it's been a long time since we worked on getting tribes access to Title 20 just because of sort of the environment, political environment. But there's a social services block grant coalition made up of a lot of non-native organizations, even states, groups. And they actually said, you know what, we want to put in a set aside for tribes here, and we want to make sure that you're not left out of this. Are you okay with that? And I was like, perfect, that's it. They came to us, very thankful for that kind of partnership and support. So this is our last, we have a few minutes left, and I would just love it if we could, if you've typed in questions to the chat, some things like that, I'm going to have Jeremy ask those questions, and I'm going to try and respond to as many as I can.
Okay, David. So our first question that we have, and again, thank you for putting together all this information. And if people want to submit questions either in chat or Q&A, we can do that. And I also believe that if you raise your hand, I can try to unmute you if you'd like to ask live, David, if that's something you would want to try. Okay, so the first question is, the Title 4B Subpart 1 separate from the money that came down from the Children's Bureau called the Transitions Grant.
Yes, and the question?
So the question was, is the Title 4B Subpart 1 separate from the money that came down from the Children's Bureau called the Transitions Grant?
Yes, there's Title 4B seems to be a program that has been focused on here in the COVID-19 work. Mm-hmm. Welfare. And so there, if you're a tribal grantee, for instance, see the transition, you know, the Family First transition funds may be coming through to your tribe first, and then these other funds should be coming shortly after that, I would think. How it comes down, will it come down in one big amount, or will it come down in smaller amounts spread out over time is not, we're not sure about that. I had heard about a week ago that one tribe who is a 4B grantee said they got about, and they say put it 1/9 of the amount of funds that they should have been receiving from the Family First Transition Act funds. And they said that they were told that the additional funds would be coming soon, although not exactly sure when. My recommendation, of course, is to have you just reach out to the Administration for Children and Families regional office in your area and ask them about all those 4B funds. Ask them how are these going to come to us? What's the timeline? That's what I would do to get more information.
Great. And so the second question is, what can state judicial systems do to support or better collaborate with tribal communities during this crisis?
Great question. I know that some of the state court improvement projects, and almost I think 47 out of 50 states have court improvement projects. Some of them have laid off staff, but some of them are still operating. And to the extent that your tribe is engaged with any of those, maybe your tribal court judges, I think that might be a good venue to be communicating some of what your needs are and what your families are experiencing. I can only imagine that, with the Indian Child Welfare Act, of course, there are specific requirements. Think about things like active efforts, and what if families aren't seeing active efforts right now for different reasons? That's the kind of thing that needs to be communicated so that we don't have families going to state court hearings and they're not getting the full benefit or protection of NICWA. That's the kind of things that we really need to be sharing with our state court friends. I think it would be also important maybe if you're seeing that proceedings are moving forward, to make sure you're sharing with state court judges, here are the specific COVID-19 challenges that are happening that we think are impacting our clients, our ability, our community's ability to be able to do the things you're asking in a case plan, for instance. And we want to make sure that the agency, who is also feeling some capacity issues, is making sure that they're still trying to provide active efforts. And one of the best ways they can do that is make sure that they're talking with the child's tribe to have those conversations about what active efforts looks like right now in this current environment.
And the third question that we have here is, are there counseling sites available for people to deal with anxiety and stress?
There are some, I don't know about national sites. I mean, there are many of the same kinds of call-in sites. I hear that they're getting a lot of extra calls, especially suicide prevention lines, things like that. But I would also be checking within your state and your area, your kind of more local area, to ask like mental health agencies if they know about resources for people to call into to get some help or support during these times. I'm not aware of any, I don't know if there's a website, but what I'm going to do is I'm going to look into this a little bit and see what else I can find. And then we can post an answer to that question after we've done a little research.
Great. And then in terms, I think that might be it for questions. We got a comment that said, "Hi everyone, and thank you NICWA for putting this together. The Tribal Law and Policy Institute has put together a COVID-19 microsite as a clearinghouse, and we're trying to point people towards helpful resources." So yeah, we'll take a look at that after this session. We can probably send that out to everybody. And if there aren't any other questions, I'd really like to thank David, Amory, and Sarah for just helping put these together. Thank you to the members and participants for joining. David, do you have any last words to send to people?
Just please be safe. And if you think of something you want to share with us, or you have a question, please contact us. We're more than happy to take your calls, your emails.
Oh, and David, actually one more question if you have a second.
Sure.
So I saw that someone asked about, they said their tribe does not get Title 4B funds. How can they get them?
Contact your Administration for Children and Families regional office in your area. And again, there's 10 of them. So if you Google this, you put in Administration for Children and Families and then put regional office, and it will tell you which office, they're grouped by certain states, and that will tell you which one. And then you can contact the ACF representatives there to talk with them about how can I become a Title 4B grantee. Great.
And someone just put in one last question, which was, what resources are available for housing urban natives?
Did you say housing?
Housing urban natives, yep.
Oh, I think that's kind of on a local area. You would find those resources, but we can look at and talk with some of our housing friends and see if they have any additional insight into that.
Wonderful. Okay. I think that's about it for everybody.
Okay. Thank you, everybody.
Thank you, everyone.
Good week.